Chairside dentistry is the single biggest chunk of your GC exam, and this chapter is where it starts. In this week's study session, we are breaking down cavity classifications, restorative terminology, and the two aesthetic procedures that show up again and again on the GC exam, straight from your MDA 15th edition textbook. Hey, DA besties, it's your girl Leela. Who else? And welcome back to
The DA Study Spot, yeah.
Chapter 48 is general dentistry and it is dense. So think of this video as your roadmap to what's inside of chapter 48, not the full breakdown, just enough to know exactly what you need to master. Let's get started, but before you do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it! Operative dentistry is simply restorative dentistry and it is the primary focus of the general dentist. It's indicated anytime a tooth needs to be restored to normal function or improved appearance. Think decay removal, replacing a failed restoration, or replacing missing tooth structure. The whole framework for how a dentist preps a cavity actually traces back to G.V. Black, who defined the basic principles of cavity preparation back in 1896, and dentists are still using that framework today. That name alone is worth remembering for your exam. Before a dentist can restore a tooth, they go through a specific sequence of preparation steps, and you need to know these four terms by name. Starting with the outline form, which is the design and initial depth of the cavity. Then your resistance form shapes the walls for strength and durability. Your retention form shapes the walls to help the restoration stay in place, and your convenience form shapes the prep for easier access. Now, these four terms will show up constantly in GC questions, usually asking you to match the term to its definition. Now, this is the heart of the chapter. These are the 6 classes of restorations, and the exam expects you to identify which class fits which scenario. First, we have class 1, which is a one surface lesion involving the pits and fissures of a tooth. So think occlusal surfaces of molars and premolars, or the lingual pits of maxillary incisors. Then you have class 2, which is an extension of class 1 into the proximal surfaces of premolars and molars, 2 or more surfaces involved. Then class 3 affects the interproximal surfaces of incisors and canines without involving the incisal edge. Then there's class 4, which is similar to class 3 but larger. It does involve the incisal edge. Class 5 is a smooth surface restoration near the gum line, often linked to poor oral hygiene, high sugar intake, or aggressive brushing. And lastly, class 6, which are repairs, defects on the incisal edges or cusp tips, usually from wear or trauma, less common but still testable. If you are a visual learner, I do have these 3 cheat sheets available right here on YouTube in my post if you want to screenshot those for reference. They do pair perfectly with Domain 3 of the GC Success Bundle. Now, we still have the specific preparation steps for each class, the special considerations dentists watch for with each one, and the exact materials used per class. That level of detail is exactly what separates a pass from a fail on Domain 3, and it's fully broken down class by class in the GC Success Bundle. 2 more high-yield topics from this chapter: veneers and tooth whitening. Veneers are thin shells, porcelain or composite, bonded to the front of a tooth to improve appearance. There are 2 placement techniques, direct and indirect, and the exam does test the difference between them. Then you have tooth whitening, not to be confused with teeth cleaning, which relies on peroxide-based products at different concentrations depending on whether it's in office, at home with custom trays, or over the counter. The dental assistant's role here, from impressions to patient education and sensitivity, is testable material. All right, y'all, and that's pretty much your roadmap to chapter 48. Operative dentistry, prep terminology, the 6 cavity classes, and aesthetic procedures. This is Domain 3 territory, the single biggest piece of your GC exam, and it's not a chapter to skim on. So if you want the full class by class breakdown, preparation steps, special considerations, retention pins, intermediate restorations, and the complete veneer and whitening procedures, that's all in my GC Success Bundle, linked in the description box. If you found this video helpful, be sure to hit that thumbs up button, and if you have an exam date coming up, drop it in the comments so we can all root for you. So be sure to subscribe and share this video with a DA bestie, and I will see you both at the next study session. Bye.
The DA Study Spot, yeah.